Hi, my name is Kelly Reed. I am an MSN student with Kaiser University, and today I'm going to be speaking to you about the crisis of homelessness in America. Homelessness affects all ages, races, and sexes. This vulnerable population is in need of several things. First and foremost, they need food and shelter. Many people go to bed on the streets not knowing where their next meal will come from. Next, they need protection from the theft and violence. Living on the streets is dangerous, and they travel with all of their worldly possessions. This makes them vulnerable to be robbed or hurt. Finally, they need adequate health care, whether it's due to mistrust, inability to pay, or the fear of having something truly wrong with them. The homeless population puts off going to the hospital until it's too late. It's not uncommon to see a homeless patient come in with a wound that is so bad they end up losing a portion of their extremity. So how bad is the problem? In 2020, it was estimated that 580,000 people in the US were homeless, and that was before the pandemic began. Some experts have estimated that the number of homeless could rise by up to 45% with the housing crisis that the pandemic has created. Of the homeless population, 48.3 are Caucasian and 39.4 are African American. Men make up the greatest number of homeless population at 60%. However, women are more likely to seek shelter, which leaves more men living on the street. In addition, the nonconforming or trans population are more likely to sleep on the streets than either men or women. Families, including children, make up to 30% of the homeless, but most are in shelters and not on the streets. Florida fall in the nation, we are ranked in the top 20. On average, there are 127.2 homeless per 100,000 people. You would think that bigger cities would have a greater number of homeless, but the three Florida cities that are above the national average are Gainesville, Tallahassee, and Fort Pierce. This population suffers from several health disparities such as mental illness, including depression, and substance abuse. These lead to an increased morbidities in people who also suffer from obesity, diabetes, and cardiovascular disease, to name a few. To compound the problem, the homeless are at a greater risk for communicable diseases such as airborne infections, parasite infections, sexually transmitted diseases, and bloodborne illness. All of these problems add up to a major decrease in the life expectancy of someone who is homeless. It is estimated that this group can have a decreased life expectancy of up to 30 years. The population tends to delay seeking care. When they do seek help in the hospital, it is costly and overwhelming on an already strained system. The Royal Perth Hospital in Australia conducted a study and found that 30% of their ED admits were homeless. This put a financial burden of 2.4 million in that year. Some hospitals are laying off nurses and closing their doors due to financial reasons, and this extra burden does not help. Additionally, when the homeless need a rehab facility and aren't a safe discharge, they end up staying in the hospital for extended periods of time. The American Nursing Association developed an Ethics and Human Rights Statement in 2017. The Imperative Statement 8.4 states, nurses must always stress human rights protection with particular attention to preserving the human rights of vulnerable groups such as the poor, the homeless, the elderly, the mentally ill, prisoners, refugees, women, children, and socially stigmatized groups. So as nurses, we should also strive to protect all human rights, regardless of their socioeconomic background. Meant to help our patients' needs. We must advocate for them when they don't know how to advocate for themselves. The homeless truly need our help. So you might be asking yourself, what can you do? You can advocate for our patients by helping them obtain shelter information. Social workers are a great resource for this. You can also help your patient obtain insurance. Many hospitals have change.org representatives, and you can make sure that your patient is in contact with them. Next, you can work with your hospital to help develop programs for the homeless. This can include access to free healthcare at clinics, access to needed medication, and disease education programs. Finally, make sure that the patient has a safe discharge. If they have a healing wound, then going back to the street is not going to be a healthy option. In conclusion, homelessness is a worldwide humanitarian crisis that affects many Americans. The homeless population suffers with disease with little help which puts a burden on our healthcare system both financially and physically. Finally, homeless can expect to have a shorter lifespan due to the lack of resources and the fact that it is physically demanding. Unfortunately, this problem will only get bigger, especially with the current financial downturn that the pandemic has left many Americans facing. Thank you for taking the time to listen to my